My name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by nurse practitioner Sara DeSilvey, who works at Northwestern Georgia Health Center, and we're going to be talking about a new comprehensive social needs screening process in primary care. So thank you for joining us today.
Thank you for having me.
So it will be wonderful, because I can't believe it, that this is the first time for you to be on this show. It's like crazy, but I'm sure there's going to be multiple times now as you get introduced to our community. So Sara, why don't you introduce yourself to the community, and then we'll have a comprehensive conversation about your assessment.
Again, so my name is Sara DeSilvey. I'm a nurse practitioner at Georgia Health Center. I've been there about 8 years now, which is interesting. It's like the time is just flying, I know.
Yeah.
So I have a couple different roles in the community. So primarily, when I do work full-time as an NP and in family practice, I am pediatric faculty at UVM, so I see newborn babies. We just saw a couple this week already. All the way to older folks. There is no limit to my practice. And then I also serve as a role for the Accountable Care Organization that helps with health reform in the state.
Okay.
I represent our 2 counties, Franklin and Grand Isle County, to the ACO for clinical concerns. So I'm basically the clinical lead in between the ACO and our community, which basically just like trying to focus on how to take care of the population well. And then I'm also in school, actually getting my doctorate. Busy girl.
Okay, so what's the doctorate focus?
I'm a doctorate in clinical practice and nursing, so a doctorate of nursing practice. So it's
wow. Look where nursing has taken you.
No, nursing's good to me. It's my second career. I think we were talking about this actually before the camera started rolling. I was actually a farmer and a professor of farming in Montana for 12 years. Before I became a nurse, and I really felt a calling to nursing. I was sick with the birth of my son, and I met a nurse, and I told her, I think I know what I'm supposed to do when I grow up. We were actually just saying the same thing.
Wow.
And I sold my farm and came back to nursing. And actually, since I began, and this is like the topic of the conversation, ever since I've started, every moment of my practice has been focused on trying to figure out how to solve the needs of poverty better in clinical practice. Every paper I've written, my project and my doctoral work is really trying to bring in social needs into the medical setting, because we can't move the dial on any medical condition without understanding a person's social and emotional and behavioral context. So that's been my mission from the get-go.
Wow. It's amazing how your past career and now here are coming together in these social needs.
I know.
In your practice.
Yeah.
You think about that. Wow. So the comprehensive health risk assessment, tell us a little bit about that and how that fits into your primary care practice.
Okay, so I think most patients are accustomed to getting some kind of screen for different conditions when they go in for preventative exams or new exams. So if you're an older adult, you might get a depression screener or an anxiety screener. Young adults get alcohol and drug abuse screeners and depression screeners. Through Medicare, we're actually mandated to screen for many different concerns to make sure that we're assessing patients' risk well. That's part of a visit we call the annual wellness visit. There's been really deep conversation across the state in the last, I'd say, 5 to 10 years on how to integrate social needs screening into those kinds of comprehensive assessments that we do in preventative exams. Last year, the Child Health Advances Measured in Practice initiative implemented food insecurity screening in pediatric and family practices across the state, and it was really powerful. And then nationally, actually, Medicare is involved in a pilot project called the Accountable Health Communities Model. And food insecurity screening and housing screening and transportation screening are all part of that as well. So it really became time for our primary care and family practice settings at Northwestern Medical Center to standardize that process. It took us about I'd say a year and a half to really review the evidence about what screeners we thought were best and least cumbersome to the patient.
Right, yes.
Because we're required to use evidence-based screeners because we are a patient-centered medical home, which is a topic we can talk about in another day.
I know, I'm just thinking, oh my gosh.
I know.
You're
It's
just
all
coming
very,
back and back.
So part of our practice is that we care about using screens that are actually going to screen for the things that we want to find. So as of this year, it just started. We used to only do this comprehensive health risk assessment in Medicare patients, but now all adults are getting a screen that includes food insecurity screening, housing instability, which is different than just homelessness. It covers multiple moves, because we know that multiple moves decreases your ability to manage chronic conditions. It includes inadequate housing, which is mold, like poor housing conditions, which we know can exacerbate many respiratory illnesses like asthma and COPD. It includes transportation concerns, which can complicate your ability to get to the pharmacy, get to your doctor's appointments. It also includes many mental and behavioral health concerns. It includes screens for substance abuse, alcohol abuse. It includes a screen for social isolation so that we can make sure that you have people in your life that can help you care for your concerns, so that when you're not with us, we know there's someone you can lean on. And gosh, it just goes on and on. I know, but it's a once a year thing. And so far, our feedback from the patients is it hasn't been too burdensome, because instead of getting multiple screens over multiple settings, they're just getting one. And then for pediatric patients, it correlates with an update to the American Academy of Pediatrics Bright Futures guidelines for screening in pediatric care that also include many of these concepts. So whether you're going to be in a pediatric setting or in our family practice, screening for social needs is going to be a common theme across your experience at Northwestern Medical Center.
Wow. And so you do this screening. Then what happens? What's available for the patient? If you come across something, I mean, you're just uncovering potentially so much. It's very, very important. But what do we do with that information?
I think the first thing that I would always say is we prioritize the patient's needs, right? So the clinician needs to know the experience of the patient in order to take care of the patient well. But the clinician needs to listen to the needs of the patient to pick what to intervene on next, right? So what we classically do is say, okay, these are all the things that we've discovered, right? Some of these things I need to note in your record just because, like, if we come up with alcohol use disorder, that has to be interacted on, it has to be intervened on. But the social needs, basically we ask the patient, what do you want to prioritize to work on today? Can we get you any help, right? And the amazing thing about our team at Northwestern Medical Center, because of our partnership with the Blueprint and because of our partnership with our local designated agency, Northwestern Counseling and Support Services, is our little teeny practice has an amazing team of support that's there for you. Wow. We have a nurse who's a case manager who can handle medical concerns. We have a social worker who's there every day who can handle any kind of in-the-moment need for mental or behavioral health. We also have a social worker we can refer to if it's just concerns of social needs, like if you need to get connected to food stamps, or if you need to get connected to the WIC office and that hasn't happened for you yet, or if you need information on food banks. We basically have resources in the clinic with people that you know best, trying to make sure that we're doing everything we can to help you.
Wow.
I
So
know.
you have a team right in your office?
We have a team right in our office.
Wow, so that patients come in, you do this assessment, and if there are things, they can get started right away.
They can get started right
Before
away.
they even walk out the door.
I know, we call
They've got
them-
so much when they leave.
Yeah, we call it the warm handoff, right? So if a need is identified in the clinical setting and the patient everything is driven by the patient here. So we can find something. If the patient doesn't want to proceed, we have to respect the patient.
Sure, of course, yeah.
But if the patient's willing, we can do a warm handoff to a clinician and a specialist right there in the office and connect them to services.
Wow,
I know.
that's fantastic.
It is.
So you talked about the partnership with NCSS, and then you also mentioned some words, I think, accountable community for health.
Yes.
So how are we working to bring the community together? So you have your practice, you have this team there. It's sort of like, then what? How does this all fit together?
Wow, that's a big question.
I know, but I know you can answer it. I know you're right in the middle of it.
I know, I'm right in the middle of it. I think the thing to say to patients that's really important is that there used to be a time when you could maybe there was a time when you could come in and get your medical thing met, but that was all we were worried about, right?
Yeah.
And it's not that way anymore, right? In order to care well, we know we have to care and see you as a person within a community, right?
Exactly.
And so we care for the person and your complex needs, and we're trying to care for the community as well. And the community, and you know this as the CEO of Northwestern Medical Center, Northwestern Medical Center is very invested in caring for the community, right?
Yeah.
Respecting our community partners and our community-based organizations, working with our affiliates, whether it be the Vermont Department of Health or NCSS. Like we're very, in order to achieve what we call population health, we need to make sure our lens is focused wide enough to conceptualize the needs of the community as a whole. So what you mentioned was the accountable communities for health. So in my role, I'm going to step back a little bit. The ACO, you brought that up, is a little bit complex, but if you could imagine that there's an organization in this state that's trying to figure out how to take care of patients better collectively.
Yes.
So all the hospitals in the state are gathered, all the departments of health. I mean, on all the home health agencies, we're all sitting around a table trying to figure out how to do that well. And then in our little teeny health service area, there's a microcosm of that as well, where once a month we sit around a table and we talk about how to take care of each other well.
And that's like all these community
All
providers.
the community, that's the skilled nursing facilities.
Yeah.
That's the NOTCH, the federally qualified rural health centers. Mm-hmm. That's the Department of Health. Planned Parenthood sometimes comes to the table, and we always appreciate them. Howard comes to the table. And so when we talk about being an accountable community for health, we really talk about owning the responsibility of trying to wrap around the complex needs of our community. What does that look like, right? As a clinician, I can't just care about their diabetes medication.
Yeah.
I have to care about whether they have safe places to walk,
yes.
right? I have to care about whether they have food access, right? We have to care about whether they have cars and transportation to pick up their medicines, right?
Right.
So we have to, as a community, rally together to comprehensively look at these needs. Otherwise, we're never going to really improve the health of our patients in a holistic way.
Wow.
I know.
It was a very complex question. I knew you could handle it, but you were able to pull it together in a way that I think folks can understand it. So as far as, the community and folks coming either to your practice or just living in this community, what do you think is different? What's been the benefit of rethinking how we care for the population versus just the medical condition? So what's the benefit, do you think, to the community, to our viewers that are listening? Kind of why are we having this conversation? It's to benefit the community, of course. But when you think about individuals and how it's impacting them, are we kind of really moving to a better system of care? So if there were a room of patients here, how would they be benefiting from this conversation and the work that's going on in this community, do you think?
I think I'm going to talk first as a clinician, because that's my own personal. I think that the first thing that I feel is a sense of hope, right? So I feel like collaborating with my colleagues in the community to collectively labor to improve our community's health is a hopeful enterprise, right? Yeah. I'm no longer doing that in isolation in my little clinic. I'm doing it with the best minds in the community, and we're all on the same task, right? That is, it gets me a little misty. It's like, that's a hopeful enterprise, right? And the thing that I would say for patients is that it's more seamless, and there's improved communication when we work together, right? If we can agree on common standards of screening, and if we can agree on the resources we need to support patients to be well, then they're not going to get different messaging from Georgia Health Center or the Department of Health, or when they're discharged from the hospital for chronic heart failure. And the home health nurse is going to say the same thing as well, right? So part of it is like most of the complaints I hear from patients, actually the only complaints I hear usually are about poor communication, right? So if we can agree on common standards and principles and even agree on how we communicate, for instance, in the social needs screening, our health service area agreed to collaborate to share processes on social needs screening so patients aren't getting screened multiple times. So we're using similar screeners, so patients go to the NCSS or Department of Health, they'll have the same experience, that we'll be able to share information. So if it happened once a year,
really connected.
It's so connected. Trying to improve and streamline our processes, right? So that their experience of care is more elegant. Like,
yes, whatever door our patients go into, we're connected.
Yep.
There's these warm handoffs that you were talking about, but we're sharing information, so it's a continuum of care.
Yeah.
That's wrapping around the patient for success wherever their needs might be.
that is the goal for sure.
That's fantastic.
Yeah.
Oh my gosh. You know, our time is crazy. I mean, it's like it's gone so fast. So
we
I think
talked
it's
about
gonna,
all of the things.
I know. But you know what, now if you come back after you've done this screening tool and you've really worked with the population more, it would be interesting to know what are the trends, what are the priorities, because you know we do the community health needs assessment.
Yeah.
And so much of it, comes out there. And just as a sneak preview to that, the one that we've just done, the data isn't all out, but food insecurity, for example, is hitting on that list. You know, mental health and substance abuse, top of the list, obesity, top of the list. So, but this is the first time we've seen food insecurity pop in. Maybe because we're more aware of it, so we're talking about it, but I really am interested to see your findings. So you have to come back. You have to agree to come back.
I promise I will.
Well, thank you so much. It's been a pleasure.
Yeah.
And I'm Jill Berry Bowen, your host of the NMC Health Beat Show, and it's really been fascinating to me to think about how in primary care your providers, such as like Sara, are really wrapping around you as a total person, meeting you where you're at and your needs. So thank you for joining us this morning.